I show up for my family. I breathe deep. I move. I check my blood pressure to reduce my risk. I hope my kids think I'm supermom. But if 1 in 5 women will have a stroke, my real superpower is prevention. I rise for tomorrow by defeating stroke today.
You might not think you're at risk for stroke, but anyone can have a stroke. No matter your age, gender, or race, stroke can strike at any time. It's important to know what to look for in case of stroke. Use FAST to remember the warning signs of stroke. F is for face, A is for arms, S is for speech, T is for time.
Sometimes stress feels like the only constant, and I know that stress may lead to heart disease and stroke. So today I decided to put my phone down and simply breathe. I'm focusing on what I can control, like turning little moments into me time to help my mind, heart, and body. I'm reclaiming my time. Deep breaths for just 1 minute, a walk with my dog, or calling a friend. This is my time and my health, and moment by moment, I'm owning it.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Hey, good afternoon, everyone. Thank you so much for being here with us for this final webinar in the Check It Community Conversation Series, Improving Mental Health and Wellbeing. My name is Sabrina Dami. I am an anchor and reporter at News Channel 13. I've been here for just about 20 years. June will be 20 years here for me, and it's exciting. It's a fast-paced job. It comes with a lot of stress over the years. And so I find as I get later in my life, I crave routine to help manage stress and anxiety for myself. I love walking my dog each morning. That tends to be my meditation. If I don't get to the gym and stick to the clock, I find that stress and anxiety starts to bubble up a little bit. So being in this deadline-oriented job, everything kind of has to line up just so I think for me to feel at ease, which is kind of counterintuitive. I think we think, oh, we need to lay back and relax a little bit and have things fall into place sometimes, but that's just not, I think, what brings me ease. So we're really in for a great conversation today about mental health, about well-being, about mindfulness, and how all of that connects to our physical health and how it's all intertwined. So I'm happy to be here with you moderating the conversation today for the 2025 Check It Challenge as we wrap things up. The annual Check It Challenge is a free evidence-based wellness and blood pressure management program that focuses on improving your health by making simple changes to prevent and manage high blood pressure. Now, throughout the past 4 months, we've been talking about understanding your numbers, making some small changes to make some big improvements in your life and in your health. So if you've missed any of the American Heart Association's resources, or if you want to go back back and review some of the content, you can go to the website. It is www.heart.org/checkitny. The Check It Challenge would not be possible each year without the support of our generous sponsors that you see right here on your screen. So thank you to Broadview Credit, Federal Union, Baxter, Central Hudson, the Kinney Drugs Foundation, and media sponsor CNY Latino. Now, a quick check on some housekeeping for the session today. We will be keeping everyone muted, but we would like to know that you are here joining us. So if you could please go to the chat box, let us know your name, where you are watching from, where you're joining us from, the organization that you're with. And in the chat box, be sure to select everyone or else we all won't be able to see it. So again, thank you so much. We are going to use the chat box for questions throughout our session. And while our panelists are speaking, feel free to put your questions right there in the chat box. We will hold those questions and get through as many as we can during the Q&A right at the end of this session. If you need any assistance with finding out where to put all of this, you can just use the raise your hand function. You see that little hand at the bottom of your screen here in the Zoom window, and an American Heart Association staff member will connect with you and help you out. And as a reminder, this is a public event, so please avoid maybe sharing any personal medical information in the chat box so that you can keep that private. We are recording today, and that will be available. This recording will be available on the Check It Challenge website and the American Heart Association Eastern States YouTube channel. So this one-time registration that you're using today, it gives you access to all of the past recordings as well and the resources on the event website. So again, that website, www.heart.org/checkitny. If you're using social media throughout this conversation, please use the handles you see here on your screen. At the at symbol AHA New York or hashtag check it. You see it right there on your screen. All right, that is it for my housekeeping announcements. Let us bring in our first guest, Allison Graff. Allison has a great story. She's a survivor, a yogi, a health coach who has overcome a range of health and life challenges. That includes heart conditions, mini strokes, brain surgery, personal hardships such as divorce, a custody battle, her father's battle with ALS. And through all of those experiences, she has learned to maintain a positive outlook and prioritize physical and mental health, crediting mindfulness and yoga as key elements in her healing process. Now, Allison uses her personal journey and professional training in yoga, mindfulness and meditation, and integrative nutrition to help others approach their health and wellness through mindfulness. Whether she is teaching yoga, leading mindfulness practices, or coaching clients, Allison provides a supportive space for mindful health. She specializes in guiding clients to identify their unique body, mind, and spiritual needs, helping them navigate their health journey with intention and clarity. She particularly works with individuals feeling stressed or overwhelmed, helping them chart a mindful path towards holistic health. We all could use a little Allison in our lives.
That sounds great. I'm like,
Oh,
sign me up. That's
yeah.
wonderful.
What an impressive resume you have. Of course, you've been through quite a bit that has led you to where you are today, Allison. So thank you so much for being with us. Of course, May is Mental Health Awareness Month, so you will be leading us through a guided meditation. Tell us a little bit about yourself and what you have in store for us.
Oh, absolutely. Excuse me. I call myself a mindful health coach because I have gone through a lot of big health changes, and I explain it as the rug's been pulled out from underneath me over and over again. But like you said, Sabrina, the only constant is stress. Stress never goes away, whether you are 13 or 31 or in your 80s. Stress is anything that pushes us beyond what is comfortable. And so the idea of mental and physical health go hand in hand. As we want to do more, like you said, you're an active person, you want to be able to balance these things. As the doing decreases in life for whatever reason, we rely more on the not doing. So learning the balance between doing, waiting and seeing, letting things settle, picking up where you left off is a practice. It is not something that comes easy. It comes very easy to do, but you ask someone to stop and be still and be quiet for a couple minutes. And it's like, well, I can't do that. I'm too busy to do that. We come up with lots of excuses why we can't do it. But the rule of the human body and mind is whatever you do a lot of, you need to balance with the opposite. So if I do a lot, I probably need a little of not doing time. And that
Oh,
not
not a lot. Yeah.
doing, right? That not doing comes in the form of taking your dog for a walk or taking an intentional walk where you get rid of the cell phone and you're just walking. You're noticing how beautiful the sky is and how the grass sounds, whatever. It could be honking horns, whatever the sounds are around you. Peace doesn't come from sitting on a cushion. Peace comes from being okay with where you are right now.
I'm
So,
so glad you said
yeah,
that, Allison, because I think a lot of times people think of mindfulness and meditation and they think quiet, and that necessarily isn't the case, right?
absolutely not. We can practice a moment of mindfulness right now without it looking, right, yoga-like or meditative. We can just pause and just focus on one thing that you're looking at right now. Of all of the things there are to choose, just pick one and allow your awareness to settle on that one thing. Let everything else settle away and notice the texture of that thing that you're looking at. Notice how the light hits it. Imagine what it might feel like. Maybe there's a smell that comes with it. All of the questions. We allow our mind to settle right here and right now. We don't want to change the thing. We're not coming up with an action plan for the thing. We're just allowing all of our focus and our senses to land. And that act of choosing and slowing creates a connection in the brain that when I choose to focus my energy on something, it stays there. And when it wanders off, I practice bringing it back and starting over. So, okay, I'm wandering off and now I'm noticing this other pretty thing. Okay, that pretty thing is beautiful and wonderful, but we're over here. Let's settle back on the object, center and ground all of our senses in something that is right here and right now. This is the only thing that matters. But what? I want to go over here, something shiny. Nope. Begin again. Bring the attention back. And when your attention is focused on the senses, what are you smelling right now in your environment? Maybe if you don't smell anything in particular, you notice how the air enters through the nostrils, how it exits, how as it enters the nostrils and fills the lungs, how the body changes. And then how as you exhale, the body softens, become less restricted. Or maybe think about the toes or the bottom of the foot and see if you can release some of the tension in the foot through the sensations of the skin. Studying wherever you are, maybe on what's going on in the mouth. Is the tongue pressed to the top of the mouth? Or can you swallow and allow the jaw muscles to fade, to release and relax? So anything that we can observe that's happening right now is happening in the senses. When we remember something that happened, we often don't think in terms of, oh, I felt dew on my skin, or I felt, sweaty. We don't have sensory memories. We might remember that we thought that we were sweaty, but most of the time we're not feeling those sensations. So if we can ground all of our senses in whatever's happened, if the baby's crying, if the car is running, whatever is happening around you, okay, this is happening right now, and allowing it to happen.
I already feel more relaxed.
That a long answer, right?
That's
Long answer.
fantastic. I already feel more relaxed. I feel like a lot of people attempt meditation, mindfulness, and they feel like they're not maybe grasping it, they're not successful with it. How long do you think it takes to practice and actually get a good handle of, okay, I can do this for 5 minutes, I can do this for 10 minutes? How long do you think that takes?
A lifetime. It's a practice, right? It changes. When we are in our 30s, the practice looks different. When we're in our 50s, it looks different. But the idea is the practice and you are always remaining the same. And the more and more we can just stick with ourselves right now, not what 20-year-old Allison used to do or what 60-year-old Sabrina is going to think to do, just right here and now. And if I allow that awareness to shift with me, then I'm going to answer the needs of my body and my mind. What do I need right now? Not out of habit. We do a lot of habiting, which
And
leads us, yeah,
I think
in
we
weird
want to
places.
be good at it right away. And so it
Ah.
becomes almost this self competition that, I didn't get it. Oh, my mind wandered too much. You are also a yoga instructor. You practice yoga regularly. How would you say yoga fits in with mental health, with keeping your mind in a place where it is able to practice mindfulness?
Most definitely. So it's all infused. For me, the more we can bring the body and the mind together at all times, the better it can be. So an example is I'm at work and I totally forget to eat, so I don't eat. That's not okay. So what do I do to correct? Right? How do I put alarms? How do I use assistants, people in my life? Right? How do I use what I have right now to do what I need to do? And that's what we're all trying to do, but it's so loud. There's so much to listen to. Meditation and yoga bring us back to being one. Our body, our mind, our breath, our spirit is all in one place. So your yoga may be riding a bike. Your yoga may be walking the dog. Your yoga may be blank. Whatever gets your body and your mind and your breath together, you're all working on the same team. What is that for you? Maybe it's swimming. So the yoga is the combination of body movement and bringing the mind here, right? Not walking on the treadmill with, constant news in my face. Nothing personal, right? But there's sometimes we just need to eat while we're eating to appreciate the fact that we're eating.
And just shut things off for a few minutes. I
Yeah.
love that how you describe yoga, because a lot of times people may shy away from yoga because they think you have to be super flexible and contort your body in all sorts of ways that I just can't do. But that's not necessarily it. It's finding the activity that moves your body and calms your mind at the same time.
It does good things, right? So the yoga that we picture is just my favorite yoga class is when I do chair yoga with the average 80-year-old, because it's not about making a specific picture with the body. It's the intention of finding space in the body and time in the mind and presence of the spirit right here. So yes, it's about moving all of your joints and moving your muscles and moving your breath, all of those things, but allow what it looks like to be a lot more generic than I have to, strike the pose every time.
Do you notice a difference in your day, in how you feel, if you skip some of that time you've allotted for yourself for meditation, yoga, mindfulness? If you skip over that, how do you feel on those days?
Well, gosh, when things get busy, what's the first thing we cut out of our day? Our quiet time, our shower time, our personal time, right? Some of us even cut out lunch or cut out restroom breaks. We suffer the busier we get. But as long as we continue to make ourselves a priority, or we make our self-care a priority as much as our to-do list, right? So it's get up in the morning, brush your teeth, then take a moment to check in with myself. What do I need today? What do I need right now? What do I need to accomplish? These are all multiple questions as you start your day. But what do I need today is a big part of the equation. And culturally and socially and economically, we have pushed that farther and farther to the periphery to be our best. I am a huge advocate for being, period. If you can be present in wherever you are, however you feel, the push culture starts to fade away a little bit. And we say, I'm making good decisions for my mental health today. And I'm asking for time or forgiveness or enter whatever the need is. So if I miss it, I'm giving up a little bit of time with myself. And the balance in my life shows me, my body shows me, my brain, my breath. I start to like short breath, right? I start to get, we know the signs and the symptoms of the body. It's whether or not we pay attention.
There you go. Right. So it's something we can all try and attempt today. Allison, thank you so much. Thank you for leading us through that mindfulness activity, and it's something I hope everyone listening can take away from. Please, if you have any questions for Allison, put them in the chat box right now. We will certainly try to get to them at the end during the Q&A. And Allison, thank you so much. Let's bring Kelly Knabb onto the screen right now and have her join in on this conversation. Kelly is a pediatric nurse in Buffalo. She was born with a condition called patent foramen ovale. It's a hole in a heart, which is likely contributed to 2 strokes that she experienced early in life. In 2018, she underwent a procedure to close the hole, marking a turning point in her health journey. Those experiences have inspired her passion for heart health and for stroke awareness. She is dedicated to using her story to help others facing similar challenges. In recognition of her efforts, Kelly was nominated as a Woman of Impact for 2025 in Buffalo, a testament to the positive influence she strives to have on her community. Outside of her advocacy work, Kelly loves spending time with her 2 sons and her 2 furry companions. She enjoys practicing yoga, working out, reading inspirational books, finding peace and purpose in nurturing both her body and her mind. Grateful for each new day, she embraces life with a heart full of gratitude. In addition to her personal pursuits, Kelly serves as a volunteer firefighter, making a difference in her community through service. She also has a passion for officiating weddings, bringing joy and love to couples as she helps them celebrate their special day. Through her diverse roles, Kelly continues to inspire and positively impact people all around her. Kelly, welcome. I love all of these wonderful things that you do, officiating weddings. How can you not bring more joy to people's lives? Also spending time as a volunteer firefighter, giving back to your community, incredible things. Again, May is Mental Health Awareness Month. World Hypertension Day just passed on May 17th, and it is American Stroke Month. So I'd like to celebrate you and, of course, Allison as well, who we just spoke with, for both being stroke survivors. Um, can we go back to when you first knew that there was something wrong, that you felt like something was off with your health? Can you share that with us, please?
Yeah. So it all started for me in December of 2013. I was 35 years old. I was driving in the car with my two kids. They were 3 and 6 at the time. It was a busy day in December, so we were going through the drive-through at McDonald's for Happy Meals. And out of nowhere, unexpectedly, I lost all feeling on the right side of my body. I looked in the rearview mirror and I saw my face drooping. And it was at that moment that I knew something was terribly wrong. Like you said, I am a nurse practitioner, so I was well aware of the signs of stroke. Thinking this can't be happening to me. I have no reason to believe. And just to rewind, at the time, I did not know that I had that condition in my heart that I was born with. I was unaware of that. So as quickly as the symptoms came on, they went away, and I was able to pull myself together. Just like any other mom, I pulled into a parking spot. I thought about what I should do. I knew these two boys needed to eat, so I pursued getting their food, and I drove myself to the doctor's office, which was 2 miles down the road. Driving there, I truly saw my life flash before my eyes. I thought, this can't be it. I can't go now. These boys need me. I don't recommend driving yourself to the doctor in that situation, but as a mom, I needed to do what I needed to do. So, with two kids in tow, we walked into the office and certainly was transferred to the hospital from there. But it was really that moment in time that I realized that life can end in a flash, and you really have no warning. So it happened very fast, but it was definitely a pivotal moment in my life. I went on to have multiple tests after that to find out that the likely cause was the hole in my heart. So that moment is forever in my mind. And my story continues, and I went years again without having a stroke, and then 5 years later, suffered another one, at which time I had the procedure to close the hole in my heart. And my story is long that way, but those moments in time, especially that first one, had changed my life forever.
That sounds terrifying. And being there, like you said, with your two little boys in the car, of course, you went into mom mode. And
Yeah,
before anything, you put your children first
I
and
did.
are like, my babies are hungry. I'm going to get
Yeah.
them some food and then I'm going to figure this out. It just
Yep.
goes to show how strong moms are. But how are you now? How is your health now?
My health is great. Physically, I'm doing well. Like you mentioned, I'm serving as a firefighter. I stay active every day. I was always living a healthy life before. I didn't have any risk factors that I knew of, but now I feel that I live life more intentionally healthy, right? I know how precious life can be and how important it is to take care of yourself, self care, mental and physical. So it's a struggle every day to put that in the forefront and make sure that I'm doing that, especially as a busy working mom. But I maintain a healthy lifestyle, and it's so important to me.
What kinds of things do you put into practice on a daily basis that are just for you, those self-care moments, the healthy habits that you talked about? What do you like to do on a daily basis?
I always take time for myself, even if it's just 5 minutes, just to do some mindfulness, like we talked about. I do pray. I reflect. I like to journal. I think it's so important just to settle your mind before takes over. And so I try to do that on a daily basis. I try to make that not negotiable. I try to get exercise every day or most days of the week and stay as active as I can. I think it's important to set that example for my kids as well, so they grow up seeing not only is it important to live a healthy life, but that you can continue to do that after something bad happens to you.
Yeah, exactly. I know when my daughter sees, I have a 10-year-old, and when she sees my husband, say, I'm going to the gym for a little bit, and then we'll swap. And okay, it's my turn to go.
Yeah.
And she's like, why are you guys, working out so much? And what are you trying to do? We're like, we just want to be here as long as we
Yes.
can
I just
for
want to be
you.
here. Yes.
Um, after you had that procedure, Kelly, what was the recovery like? Were you able to kind of get back on your feet shortly after that?
Yeah, so after the procedure, the physical and the mental recovery, took some time for me to get back on my feet physically, but also mentally, both after that first stroke event and the second one. The I guess the aftermath of that, I didn't have any physical, deficit. So you couldn't see that there was an issue. No one would know that I had had a stroke, but mentally, that's what took me some time to get back. There was such fear that it would happen again. I was afraid to go to sleep at night. I was afraid to drive my car. I was afraid to go into the grocery store. I remember one time walking into the grocery store and turning around and leaving because I just couldn't do it. And that wasn't like me before. I was an active, people person. I work in the community. I take care of people for a living. And so there was a lot of fear of that happening again. And that was a lot to work through. But I did, and I got back on my feet for sure. And I knew, again, as a mom, I had life to live. I had boys to take care of. And I knew that life is precious. And I always say that this is not a dress rehearsal, right? We get one life. So we have to take every day and live it to the fullest. And so I was not going to let that define me. So I worked really hard to get through that. But I think the mental fear and the PTSD, really, for that matter, after the fact, is what took the most out of me.
The stress.
The stress,
And
yeah,
then the bodily response, I'm sure, to the stress. When you
yes,
were having those moments, you described the grocery store, I'm sure your heart was probably
yes.
beating fast, maybe sweating. And then that is all tied to our health, right? The mental health, the
Mhm.
stress, the physical health. So it probably just starts spiraling then
It
when you
does.
start realizing it, right?
It does. And then a lot of those symptoms of stress can mimic kind of what I went through a little bit, right? So then you think, I did, a lot of like, I'm okay, you're okay, look back in the mirror. I mean, there was a lot of that, and we laugh about it, but really, it's real. Even to this day, I mean, there's not a day that goes by that I'll forget what happened, or, what the toll it took on me, or what could have happened, I think is more important, and how lucky I am.
What can people take away, education wise, to learn about um, just their own listening to their own bodies? As you did, as you like you said, you have the medical background, so you were able to kind of maybe connect the dots a little faster than maybe people
Mhm.
who don't.
Mhm.
So what are some pieces of advice that you can give to people just about listening to their bodies?
Yeah, I always say it's so important. If I would not have listened to my body or done what was right and go get checked out, I don't know if my story would have been different, right? So I think it's so important to remember that if something doesn't feel right, you need to go with that instinct and you need to get checked. Like I said, it was a busy December evening. It was right before the holidays. The last thing I wanted to do was go to the hospital. And I even said that to myself, oh, this can't happen, not now. But I'm glad that I did. And so I try to share that because even though I'm a medical professional, you always think that stroke can only happen to a certain type of person and that it's so dramatic. And it's not always like that. It can be a quick event like it happened to me. It can be to somebody young or somebody old, somebody with risk factors, somebody without. So no matter what, it is so important to listen to your body and get checked out. Even if it's nothing, it's still worth, it's your life.
It's so true. Do you remember the turning point where you were able to kind of push past that fear and that stress, the PTSD you were describing? Was there something in your life that helped with that, or was it just time?
I think both. I have two turning points. So after the first stroke event, that was in 2013, and I remember in 2016 I signed up and I ran in the Buffalo Half Marathon, and I trained for it with a friend, and I worked really hard. And I remember crossing that finish line. I thought, this is amazing. My body can do this. And so that was a really big turning point for me. I went on to run two more after that, 2016, 17, and 18, and I got faster each year. And so those were really empowering. Unfortunately, in 2018, I suffered a second stroke event 5 years later when I thought that this would never happen again. So then I got set back again. In October of 2018 is when I had the procedure done. And by the following spring, I signed up and ran in the same marathon, but I did a relay. So it was a little bit shorter. And so I crossed that same finish line. And those two times were very empowering to me mentally and physically. And it was around that same time I started to share my story. And that I think was the most healing for me, is to be able to get out there and help other people, to not only share the signs of stroke and help people know how important it is to get help if you don't feel right, but also to help other people feel that they're not alone. It is a very lonely place to be in when you go through something like this and you search for other stories. Who else did this happen to? Is there anyone else at 35, a healthy mom out there that this happened to? And so I did a lot of searching when I felt lonely. And I wished I would have had more support that way. So I try to be that for other people. And so I think by sharing my story, it's both healing to me, but also helping, other people. And I've since been able to walk a handful of women through the same procedure that had similar stories. And that has been so rewarding to me and I know helpful to them. So those were kind of some of the turning points for me, or some of the things that helped me to heal both physically and mentally.
That's incredible. It's incredible, Kelly. I know, and running a half marathon is no small feat, but doing it as you're recovering from a health condition and then doing it multiple times after that. I mean, congratulations to you. What kind of responses have you received from people as you share your story? Um, have you been able to open people's eyes who may not have thought that there's anything going on with them?
Yeah, it's been interesting. I've met a lot of people that say, "Oh my goodness, my that happened to my sister," or "Would you mind if my sister contacts you?" I had somebody find me on the internet. The internet's a powerful place nowadays, and so you can Google anything. And I was able to walk one woman through a very similar story simply because she found me because she read my story that I was a runner and that I had had a stroke. Because again, looking for someone similar to ourselves that could happen to. So I've had a lot of different connections, and I've been able to get in contact with different people really across the country, which has been nice. But in our community, I've been able to share my story in different outlets, and I think I've helped on the level of just making people aware of the signs of stroke, the fact that it can happen to anyone at any age. And that there is other people out there that have gone through something like this, and there is support out there. You're not alone.
Ellie, thank you so much for sharing your story. We're so glad that you're doing well and that you're healthy,
Thank you.
and continue to affect other people's lives by talking about this. If you have any questions for Kelly, please put them in the chat box right now. We will get to them during the Q&A at the end. Kelly, thank you so much.
Thank you.
Next, we would like to speak with Dr. Anne Linhart Caprio. She's a healthcare professional with nearly 3 decades of clinical experience focusing on cerebrovascular disease as a nurse practitioner for most of her career, serving as the program coordinator for the Comprehensive Stroke Center at the University of Rochester Medical Center's Strong Memorial Hospital since 2011. Dr. Caprio has been instrumental in ensuring the delivery of evidence-based stroke care. Her leadership was pivotal in Strong Memorial Hospital becoming one of the first in New York State to achieve Joint Commission Comprehensive Stroke Center certification. Her scholarly work on reducing hospital readmissions following ischemic stroke earned the American Heart Association's Cardiovascular and Stroke Nursing Stroke Article of the Year Award in 2022. And more recently, she received the 2024 American Heart Association Cardiovascular and Stroke Nursing Excellence in Clinical Practice Award. She is a passionate volunteer for the American Heart Association, enjoys travel with her husband, and when at home can be found spending time with her husband, Tom, and their golden doodle, Riley. Dr. Caprio, thank you so much for being here with us, for spending some time as we wrap up our final session of the Check It Challenge. We want to start, if you could please, reviewing what the health behaviors and health factors are for high blood pressure and other cardiovascular diseases, and why all of these factors matter.
Absolutely. Thank you so much. First, can I just say what a privilege it is to be here with the panel of such fantastic women and stroke survivors that have really taken what has happened to them and spread it to really help others with understanding stroke, preventing stroke. And you may wonder, why is it that during a Check It challenge that's talking about blood pressure and knowing your numbers, we're talking about stroke and mental health? And it's because stroke is the high blood pressure is the leading cause of stroke. So to review some of the things that are covered in the Check It challenge, when we think about high blood pressure, we want to make sure that we know our numbers, that we're eating smart, moving more, managing our weight, not smoking, and sleeping well. Because all of these things can impact blood pressure, and we want to make sure that we are trying to achieve what we would consider a normal blood pressure. And according to the American Heart Association, that is lower than 120 over 80.
And you put normal kind of in quotes.
Yeah,
And is
I
that
did.
because it varies depending on person, on women and men, on ethnicity? What would you say about that?
Yeah, what I would say about that is that blood pressure is a lot like Goldilocks and the Three Bears. So we have general guidelines, and we want people to set a goal of being less than 120 over 80 for that normal blood pressure. However, blood pressure, being a lot like Goldilocks, can be too high. We know a lot about that. It can also be too low. And so, what the goal of keeping a healthy blood pressure is to make sure that you're getting enough oxygen to the brain and the rest of your body in order to prevent things like stroke, dementia, and other mental health issues, other lifestyle issues. So, while we give these broad guidelines and we think about what's normal, everyone can be a little bit different. And so it's important to work with your healthcare team to understand what the best blood pressure for you is, because there are some medical conditions where you might want it to be just a little bit higher or just a little bit lower than those generally recommended goals.
I, I think the number one thing that comes to mind with blood pressure for a lot of people is diet
Mhm.
and weight and exercise. But there are other factors, right, that can impact that. Lifestyle, sleep is a big one. I worked shift work for 10 years. I worked the overnight shift here at News Channel 13. And I remember during those years going for my checkups and my blood pressure was kind of wonky. It was a little bit all over the place. How would you say sleep is a factor when it comes to that?
Yeah, I'm with you. I did a lot of night shift. I don't ever want to do it again. I'm not one of those
No.
people that does well with it because it impacts sleep. And there's a lot of things that impact sleep. The thing to remember about sleep, it's so important that the American Heart Association recently updated their healthy lifestyle tips to call them Life's Essential 8 and add in sleep as one of those essential health practices. Sleep is whenever our body has the opportunity to let our brain rest. Not just let our brain rest, but let it work out all the things that happen during the day. It's a healing period. And if you really think about kind of, if you think about cleansing, right, it gives your brain the time to cleanse and the time to get the stuff out that it needs to. So, whenever we have poor sleep, we can see that there's increased depression and anxiety, memory loss and dementia, high blood pressure, um, higher blood sugars and cholesterol, more obesity, more heart disease, and an increased risk of stroke. So, we really want to see people getting an average of 7 to 9 hours of sleep a night. That's for most healthy adults. Um, Babies, little kids, they need a different amount of sleep. They may need more sleep. And as some of us who are aging may notice, sleeping tends to change as we age, and we have to work a little bit harder to get that healthy amount of sleep. And some of the things that we've already heard about, mindfulness, meditation, yoga, finding your own space, can really help in trying to make sure that you are having healthy sleep habits. Um, you want to make sure that you're trying to keep a consistent bedtime and a consistent time to get up in the morning, dimming lights before you're ready to go to bed, having a mindful routine. Like every night before I go to bed, I am going to brush my teeth, wash my face. This is my mindful routine that will tell my body it's time to sleep.
And we all know that holding these in our hands and doing this in bed before you shut the light off, or even after you shut the light off for that matter, we all know it's bad to do. We all do it from time to time anyway. So it's just being really intentional
Yeah,
about those
scrolling
steps.
doom scrolling really does not help your sleep.
You touched on mindfulness and you mentioned anxiety and depression. Um, Anxiety and stress and depression, can those directly impact your blood pressure as well?
Yes, absolutely. I mean, I think that anybody who has taken their blood pressure and had a stressful experience and then said, okay, I'm going to take my blood pressure right now to see what it is. Just as an experiment, you can see that stress and anxiety increase your blood pressure. You may have heard people talk about white coat hypertension, and this is where you go into a doctor's office and your blood pressure is higher. And so that is a stress response. So when we think about that, we really think about, if you're having these bursts of stress, these bursts of anxiety, your blood pressure is going up and down a lot, right? And you may have a period of time where your blood pressure is high for an extended period. So really, things like managing your stress, meditating, deep breathing, try it out. If you got a blood pressure cuff at home, if you're checking your numbers, which you should be, give it a shot and see what happens after you rest, relax, and deep breathe for 5 minutes before you take your blood pressure, which is actually the right way to take your blood pressure.
Would you say those spurts, if you have those little ups and downs where you're just having a day where you're stressed, you're feeling a little anxious, but you feel generally okay outside of that, is that concerning if you have just those regular days, those
I
stressful
mean,
days?
everybody's going to have stressful days. I think that it's the cumulative effect that we have to worry about. And so but I do want to key in on something you said there about if you're feeling okay. One of the big challenges we have with high blood pressure is it doesn't really cause symptoms. It causes what we call end organ damage, meaning it damages your brain, it damages your kidneys, those kind of things. But it doesn't give you those immediate symptoms, that pain that you would expect to tell you something's wrong. So you don't necessarily feel unwell if you have high blood pressure, which is why we really encourage people to check and know their numbers.
That's a great point. You don't really know something's wrong until it's gotten serious, right, at that point. If people are working towards bringing their numbers down, they're trying to do, the right things and it's not really budging and they're feeling discouraged, what can you say to kind of keep, encourage them to keep at it?
Yeah, the first thing I would say is to remember that this is a process, right? It takes our bodies years to develop high blood pressure. It can take some time to get it under control. But if you are already trying, if you're exercising for 20 to 30 minutes a day, if you're at a healthy weight, if you are reducing your salt intake, if you are managing your stress, and all of these things are not working to manage your blood pressure, there is a very large percentage of us that are going to need blood pressure medications at some point. So it's important to work with your healthcare team to try and identify when you may need to start that medication. And it's important to know that it's a combination of lifestyle change and medication for a lot of people.
Is there a push just in the healthcare system overall or the healthcare community to collectively kind of work to bring these numbers down? Are you noticing anything like that, especially here in our region?
Yeah, and I think one of the things that actually makes us pay attention to this is that we've got some really good evidence that your zip code impacts your health. So, depending upon the zip code that you live in, you may have a lower life expectancy. You may have an increased risk of stroke or heart attack. And so, we are trying to pay attention to those things and recognize that there are areas across our state where you cannot easily get healthy foods. You may live in a food desert where it's difficult to get fresh fruits and vegetables or low sodium foods. You may not have access to your healthcare provider's office easily. It might not be on a transportation route that runs near your house if you're not able to drive. So we're starting to try and pay attention to all of these things and really work with local and state agencies, the American Heart Association, different healthcare organizations to try and address some of these issues that can impact health in different geographic areas and try and identify, like, where do we need more parks so that people have a place that they can safely get out and exercise? Where do we need more grocery stores, or is there some other alternative that we can offer to people to try and make these lifestyle changes? Because it's easy for me to say, eat a Mediterranean diet, reduce your salt intake, get out and exercise 20 or 30 minutes a day. because I live in an area where that's possible, but what can we do to help people who may not?
Right, right. Whether it's, and so interesting, zip code, um, as you mentioned, the zip codes kind of bringing those different factors to the table, population, as well. I did a story recently, where there is a doctor who's volunteering her time with the homeless population because they are putting the, doctor's visits there. That's not a priority on their list. More importantly, people in that situation are looking for food and shelter. So, as you said, it's something that I think as a community that we need to address. So, Dr. Caprio, thank you so much for this great advice and for your time and expertise. And again, if anyone has questions, please put them in the chat box. And we would like to, in fact, right now, if we can, start getting to some of those. Let's start with, and this might be for you, Dr. Caprio. How do you recognize a stroke? How do you recognize the signs of a stroke?
So I would like to teach everybody on the call today the quickest way that you can try and remember the signs and symptoms of a stroke. And you saw it on the slides at the beginning of our presentation. So that is FAST, F-A-S-T. F stands for face, so facial droop. You may remember that Kelly mentioned that she looked in the mirror and she saw that her face was drooping. So a facial droop on one side. A stands for arms, but it's actually arms or legs. We want to think about if you put your arms out, does one of them drift down? S stands for speech. Either difficulty using words, not understanding what other people are saying, or slurred speech. Any of those things that happen all of a sudden, T stands for time, which is time to call 911. And we want everybody to know that if you are recognizing the signs and symptoms of a stroke, that we strongly recommend you call 911 and go to the emergency department by ambulance, because there are treatments that we can give, but all of them are time sensitive. And so we need people to get to the emergency department quickly so that we can do an evaluation to see if you qualify for an IV clot busting medication or a surgical procedure that could remove a clot to treat the stroke and give you a chance that you may have better outcomes and more chance of being independent afterwards.
Kelly, you were describing what you experienced when you were on the way to the McDonald's, and does that kind of line up with exactly what you were going through at that time?
Yeah, yeah, absolutely. I mean, it went from my face drooping to my right arm, my whole right side of my body. And I remember opening the window with my left hand and trying to yell for help, and I couldn't say anything. And that was very scary.
I can't imagine. We have another question here with someone asking, can mental health be preventative care? Should it be preventative care? I open that up to any of our panelists with their thoughts on that.
I would say most definitely. There's so many things that we can do through mindfulness, through physical activity we've talked about, that all help to support um prophylactically, is that the right word? Like preventing things from happening. Also, I want to refer to the resilience that Kelly mentioned. Mindfulness and meditation helps to train the mind to deal healthily well with the stresses that come along for us, just from this check-in, just from this awareness, just from this listening process that we do. So definitely, I believe that all of these things can help to prevent some of the debilitating effects of chronic stress in our lives.
I think that it's important. I think I have a two-part answer to this.
Yeah.
First of all, I want to say resoundingly, yes, mental health should be considered preventative health. Um, we we don't give enough credit to the interaction between our what we call our mind or mental health and our physical body. It's all part of the same package. We are one biologic package, and it is also part of the same package. And I think that both in healthcare availability, reimbursement, and focus, we could do a lot better job of trying to help people to manage anxiety, depression, stress, other what we call mental health issues better from a healthcare system standpoint. But also, personally, I think that each of us individually can do a lot to kind of think about our own reactions and how we address anxiety, depression, mental health, the language that we use surrounding it, because we've all been kind of brought up in this system of we don't think about mental health as primary care or preventive health. It's something separate from a physical disease, and so we treat it differently. But I think that from a universal health system level, we have a lot of work we could do, but each of us individually can also check our own biases and think about how we consider the interaction of stress, anxiety, depression, and these other issues on our body.
That's so true. I think paying attention to mental health is more of a recent thing. A lot of us grew up at a time where you kind of are push it down, deal with it, get through your day, you're going to be fine. But we're shifting now to no, let's talk about it as it's happening. Do any of you have advice for survivors dealing with the stress of another potential event? Allison, you were kind of just alluding to this, that if you are in, a healthy headspace, as the twists and turns of life do come at you, maybe you're in a better equipped to handle it.
I've had so many people say, "Oh my gosh, you're so strong. How have you made it through this?" I'd never be able to do it. And I'm sure Kelly can agree. Nobody thinks that they can survive a stroke. Um, but I also know that if you say, "Oh, that's never going to happen to me," right? If you completely put it on the periphery of your awareness, you're not going to be prepared. Whereas if you embrace, if I listen to my body and I'm aware of what it tells me, and then I do something about it, whether it's before or after McDonald's, totally up to you, right? But, that's an option.
I think
Kelly,
I think
go
you
ahead.
can never really control, you can only you're in the moment, right? You can't always control what's going to happen. So yes, a lot of stroke is preventable. We can take care of our risk factors, but in my case, I didn't really have much control over that, right? So I think getting to that headspace that, you can control your reaction and you can pull up your sleeves and say, I'm going to get through this. I'm going to use this for good. There is a reason for this, not, why me? I can't go on. What if it happens again? I mean, I went through all of those emotions just like anybody else. But I think taking it and using it for good has been helpful, like I said, for me and healing for me. So I think, preparing yourself for something like that when you never know what life might bring your way, preparing yourself mentally, getting yourself mentally strong, equips you and arms you for something like this. So I think should be part of prevention and a huge part of a healing process after a medical issue.
I think it's also
So well said.
that, and Kelly mentioned this, in we're continuing to learn things about stroke every single day. It changes every day. When Kelly had her first stroke, we didn't know that you should close those PFOs. When she had her second stroke, we did. Um, we recently are learning more and more about PTSD after stroke. It is a thing. It is legitimately a thing that especially we've found in those who are younger who have strokes. So recognizing that it is an issue after stroke, I think can also help survivors help each other and help themselves.
Sort of normalizing it and
Yes.
knowing, yeah, I think that's so huge. And at the time of my first stroke, like you said, I really did feel alone. I did so much searching, 30-year-olds with stroke, athletes with stroke. I did as much searching as I could to find someone like me. And then as the years went on, and by the time I had my second one, I feel like people had come out more and were sharing their stories. And so that's why it is my goal to be that person for somebody else, because it is a lonely place and you do feel like you can't get through it. And you're the only one. So yeah, I think it is evolving, and so I'm thankful for that.
Allison, Kelly and Dr. Caprio, thank you so much for sharing your stories, your expertise. We really appreciate it. I'm sure everyone listening took something away from this. So thank you all. And thank you to the sponsors for making the Check It Challenge possible. Most of all, thank you, all of you for taking your time out of your day to join us here today. The registration and log information that you use today will give you access to all of the previously recorded webinars. Again, the website, www.heart.org/checkit. We hope you have enjoyed the 2025 Check It Challenge. Keep checking your blood pressure. Let us know any changes you have made to your life by tagging the American Heart Association at AHA New York or #CheckIt. Thank you all and enjoy the rest of your afternoon.